So good afternoon, and thank you all for coming. For those of you who don't know me, I'm Luigi Zingales. I'm the faculty director of the Stigler Center. And we're delighted today to kick off our economic effects of COVID-19, a new workshop series with John Barrios and Hunt Allcott. And just as a short introduction, I think one of the benefits of an otherwise terrible pandemic is that we're all more connected at a distance. And so we wanted to exploit this to create a virtual community of people who are interested in the topic of COVID and its consequences. And so this is a seminar that is open to everybody. And we're going to start it off today with two very interesting presentations. Now, in the spirit of diffusing the information, but maintaining a collegial spirit, what we're going to do is we're going to record the presentations, but the question and answer portion in the last 30 minutes will be off the record and not recorded. So please hold off to your question until the Q&A portion, and you can submit them via the question and answer button on Zoom, or raise your hand and I will moderate. So we're going to start with John Barrios, who is an assistant professor of accounting at Booth, and his research is at the intersection of labor economics and financial and managerial accounting, and he will be presenting his paper, Risk Perception Through the Lens of Politics in the Time of the COVID-19 Pandemic, and is as half an hour. And then after, we're going to have Hunt Allcott, who is an associate professor of economics at NYU, and his research interests are in environmental development and behavioral economics and industrial organization, and will present his paper, Polarization and Public Health, Partisan Differences in Social Distancing During the Coronavirus Pandemic. John, the floor is yours.
Thank you, Luigi. Okay. Is the screen visible or my slides? Yes. All right. Well, thanks for having me on today. I appreciate the time to kind of present this new work that I have with my co-author Yael Hochberg at Rice. And one of the benefits, at least on the positive externalities of kind of the pandemic from a research perspective, is you get this kind of multitude of individuals that kind of focus their attention on the pandemic and kind of providing insight. So in this paper that we kind of look at risk perception through the lens of politics, we have a multitude of people also investigating the same topic, finding similar results. So it's as close as I have come to feeling like I'm in the actual sciences, where we have reproduction of results in real time. Within a week, you see other people using different data sets, finding similar patterns, which is kind of comforting and thinking about it in the academic sense. So in terms of our paper, kind of our thought in writing this paper is kind of understanding how individuals form expectations or beliefs given some objective data. And there's a long literature in financial economics and in economics in general about kind of individuals forming and updating their expectations about kind of economic events such as inflation in the economy. They've also kind of documented considerable heterogeneity in these expectations, right? Depending on individuals' education, on IQ, as some of my colleagues have been investigating. And then we've had kind of more like a nice logical jump is to kind of think, well, we know about there's heterogeneity in kind of political beliefs. There's a long literature kind of in poli-sci thinking about individuals' perception of economic activity through kind of this political lens. This kind of large literature of political polarization has kind of also hinted at increases in political polarization, where we kind of see homogeneous political parties with respect to ideology of their members, and which exhibits some type of hostility towards members of the opposite party. So to the extent that individuals kind of have increased the tendency to view their world through this kind of partisan perceptual screen, it's going to affect kind of their behavior. We have kind of nice new papers documenting this in other settings, like, analysts of the opposite political party that kind of view firms differently, or the economic conditions of firms differently, depending on which party is in power. The evidence, however, is still kind of mixed on how these partisan perceptions directly translate to behavior. What we're going to do is we're going to look at the political leanings of individuals, and we're going to see, does that have implications for the perceptions of risk, as well as in their decisions in a health-related crisis, specifically the current pandemic. And we think that understanding how perception in a risk perception varies in a pandemic across populations is important for policymakers, right? Because we know kind of that an individual's risk of getting infected in the current pandemic is not only a function of their own behavior, but also of the behaviors of people around them, right? So it doesn't matter if I'm locked up in my apartment, if neighbors are going around apartments and trying to interact as well. So to the extent that some populations infer lower risk from the same set of objective data, their behavior is going to impose a negative externality on others in the community. And this is going to thwart policymakers' attempts to kind of flatten the curve. As we currently see in the policy responses today, it's more about kind of voluntary compliance, and kind of that's critical that everybody interprets the information in a similar way. The increasing political divide, though, of how individuals consume the news and how they kind of interpret factual information kind of gives us some ex-ante belief that there might be differences in the perception of risk from these two groups. Moreover, this might lead then to differences in the responses to the suggested social distancing. Wide partisan health, we think that, kind of a health-related behavior should be viewed as nonpartisan, right? We always hear stories about, the virus is agnostic to political party affiliation. We would think that kind of faced with kind of death and observing death in the local community, that would be pretty objective data, so we would kind of react similarly. But individuals, we know, kind of consume information from different news sources that kind of fit some of their prior. Authority figures that might match with their priors might have a different interpretation of the data. And we're kind of being agnostic as to why individuals might, look at Fox News versus MSNBC, or listen to a Democrat politician versus a Republican. That could just be because of their political predisposition, or they might believe something about the credibility of the source. For our purposes, we're kind of staying agnostic as to why that is. We kind of take it as given that individuals have kind of a prior, that prior is reflecting some of their political preferences, and as a result, we kind of see them obtain news from different sources. At the outset of the pandemic, we could think that the data at the local level is somewhat objective, as we know the death cases and the number of people with COVID. So we kind of think that individuals are observing a particular interpretation of the data to explain any potential deviation in how they react, right? And this is kind of being shaped by the political coloring that the media might prevent, or even their perception given their priors. And as a result, we would then expect to see differences in their behavior. We're going to focus on specifically on the reaction to local cases of COVID-19 and examining the behavior with respect to kind of, are the people becoming informed, or through Google Trends, looking at search shares for the pandemic. And then we're going to look at their actual behaviors by looking at social distancing to make sure, kind of examine how individuals are reacting to these cases. The key things that we need to have in this study is that we want to make sure we control for kind of the socioeconomic conditions in the locations. We know that the spread is determined by density, by population, by a certain economic characteristics of the location. So we want to make sure we kind of hold those constant, because we do know that there's a difference between kind of Republican areas and Democrat areas. Moreover, we also want to make sure that we kind of control for the timing of the virus's arrival in the areas. We know that these Republican areas were exposed later on. So we're going to kind of use OLS and linear regression to kind of extrapolate in a kind of more of an event time to kind of get the behavior at the initial cases. Then we're going to examine differentials in compliance to state mandates. So kind of, do we see differences in behaviors even within the state between areas that are high Republican or high Trump supporter? I'll explain that in a little bit. Moreover, is the case that we're going to find an observe of differential in behavior, is that just like risk aversion, that Democrats are more risk averse than Republicans? Well, we're going to try to use the dynamics of the pandemic and show that it doesn't seem to be purely risk aversion, because we're going to see after the announcement of Republican politicians' exposure, as well as individuals at CPAC, at Republican areas start basically catching up relative to the Democrat areas in their reaction. And then finally, we're going to provide some just cross-sectional variations and differentials with respect to kind of the risk of the population using age, as well as the ability to kind of telework in terms of if you relax the constraints on social distancing, do we observe similar patterns between the high and the low Trump share? This is kind of the specifications we're going to run, and kind of given that we're interested in kind of the local cases, we're going to basically be we're going to be interested in data 2, which is the interaction between kind of the cases and the Trump voter share. So I'll kind of explain now how we measure this. For our partisanship measure, we're going to rely on Trump vote share at the county level from the MIT election data. We're going to then add in information on local COVID cases and deaths from the COVID tracking project that includes data from the CDC and multiple sources. And this allows us to get location and date of each case and death, which allows us then to assign them to a county day. We're going to have social demographic controls from the census. We're going to grab the state mandates from the New York Times. And then with respect to kind of the perceptions, we're going to be using the COVID searches from Google Trends, which is going to examine searches for COVID-19, coronavirus, Wuhan pneumonia, Chinese virus. We're also going to look at unemployment-related search terms during this period, and then see how that reacts between the two areas. With respect to social distancing and the behavior, we're going to use unicast county level data from March 24th to, from February 24th to March 31st. And that's going to give us, one, the percent change in the average daily distance traveled from a baseline pre-period, as well as the percent change in the average daily visits to non-essential retail services from a baseline period. When we look at kind of the overall descriptives of these measures, we kind of observe what you would expect with respect to the search share, right? So here I'm graphing the cumulative confirmed cases in the bars, and then I'm overlaying the average Google search terms for COVID-19. And kind of you see that around March 4th, as we start seeing an increase in cumulative cases, we start seeing a ramp up in the number of searches for COVID-19. Consistent with this being kind of exposure to the information about the COVID, after a certain period, once you kind of reach the peak of cases, you start seeing that declining because already most of the population now understands about the virus. On the right-hand side, we have kind of unemployment benefits searches, given the economic consequences as well. And you kind of see that around March, late March, when we start talking about, you know, the economic effects, we also then start seeing a ramp up in individuals looking for information on unemployment and employment benefits. With respect to social distancing, here I'm going to give you the same information at the aggregate level, and I'm going to plot just basically the average percent change in the distance traveled on the left-hand side versus on the right-hand side, I'm giving you the percentage change in the visits to non-essential businesses. And around the time that COVID starts coming in, we start seeing, as social distancing measures come in, we start seeing decreases in the change in these percentage changes, right? People are traveling less, people are visiting non-essential businesses less. The red lines indicate the national recommendations when they were first issued. And we see again, kind of this drop down. Interesting, like towards the end of March, which is when our data ends here, we see kind of a slight increase. And finally, with respect to kind of what's the variation we're going to use for partisanship, we're using the Trump vote share in the 2016 elections at the county level. And kind of here I plot at the county level the variation that we have, darker colors meaning higher Trump voter share in these areas. And again, kind of consistent with needing to use the OLS to kind of extrapolate some of these things, because we could see that the share of the darker Trump share areas tend to be in certain geographies, but we still have variations in kind of county level around the coast where we can kind of try to tease out something. All right, so the first set of evidence I want to kind of give you is just partisanship and the search. And what I'm doing here is I'm providing bin scatters where we're going to control for the number of confirmed cases, we're controlling for the population density, the income per capita, overall population, the day of the week, as well as the time since the first case was reported in the DMA. So I should have mentioned that for the Google search data, we're working with the Nielsen DMA level data, so we aggregate up to the Nielsen area. And what we're plotting here is showing that as the percent of the Trump voter share increases, we start seeing a decrease in kind of search activity around these cases, the first cases of COVID-19 in the areas. And we see the similar pattern with respect to kind of the unemployment. To more formally measure this, we're going to run kind of an OLS in the specification, and we're going to kind of be interested in the reactions to COVID-19 cases as well as the interaction with this Trump voter share. We also use an indicator for high Trump voter share being in the higher quartiles. And kind of consistent with what we saw in the aggregate level, we see that when the first case of COVID comes into an area, we start seeing a roughly around a 40% increase in the kind of the search activity for COVID-19 in those areas relative to other areas. This is muted though, as you can see kind of in column 2, in areas, as you get into areas of higher Trump voter share. And this kind of translates, if you think of a 1 standard deviation increase in Trump voter share, that's roughly around 12 percentage points. This mutes this search activity by around 8%. And we see a similar pattern kind of in the unemployment in the earlier period. So here we're looking around kind of the first cases in these areas. These results are kind of robust to a variety of kind of different linear specifications as well as fixed effects. So we can kind of do the same thing, controlling for the number of national cases at the period, because maybe my response to a local case is going to be effective by what I've been hearing about the national level. We still observe a differential between the Trump areas, the high Trump areas and the low Trump areas. And we get the same thing when we kind of control for day and DMA fixed effects, as well as when we do day fixed effects, as well as DMA, and allow each of the DMAs to have their own kind of trend in the search activity as well. Then we're going to kind of finish off the search data by looking kind of doing some event studies. So here we're going to look at kind of abnormal searches for COVID-19 relative to kind of the 5 days prior to the first confirmed case of COVID-19 on the left-hand side. And then we're going to do the similar pattern for the first COVID death in the area. And in the red line, you're going to have the high Trump areas, and in the blue, you're going to have the low Trump areas at the DMA. So we're going to see that like roughly 3 days before the first case, these areas tend to have a similar abnormal search pattern. All of a sudden, when the first case is reported, we see kind of a higher reaction in cases in the high Trump areas, roughly almost more than 40% relative to kind of the low Trump areas have a 40% higher search than the high Trump areas. But then we kind of see that by the time that we have the first COVID death, what we start seeing is an increase in kind of search activity by the high Trump areas, consistent with taking them longer to kind of catch up. So maybe the first case, documented case, doesn't affect my perceived risk as in the high Trump areas, but by the time kind of the death comes in, then we start seeing in these areas more search activity around COVID-19. All right, so now we kind of see that at least perceptions seem to vary between these areas relative to the kind of the COVID cases. How does that translate into the actual behavior, specifically the behavior that we care about in the current pandemic about social distancing? And here, what I'm going to start off again is by doing just simple bin scatters, where we're going to plot the average percent change in distance traveled on the left-hand side, and average percent change in the visits to non-essential visits on the right-hand side, relative as a function of the average Trump voter share. Again, here I'm controlling for the number of cases in the area, the population density, the income per capita, the day of the week, as well as the number of days since the first case. And kind of what we observe is as the Trump voter share increases, we observe that in these areas we see less drops in travel, i.e. less social distancing by having more activity going on. Formally, again, we can kind of examine this under an OLS framework. And what here we observe again is kind of a muted effect in the Trump counties. So for a doubling of the number of confirmed cases in the county, the percent change in average daily distance travel falls roughly around 4.75 percentage points. But for the same doubling in a county where you have with a 1 standard deviation increase in Trump voter share, this translates into a muted effect of roughly around 0.5 percentage point, right? So we do observe that there's at least controlling for all these, that we observe on average reduced social distancing in areas with higher Trump voter share, controlling again for exposure to COVID-19 as well as other determinants. This is kind of robustness. So here we're going to show you kind of the dynamics in event time that in these areas, even controlling, looking at the variation within states with the controlling for the exposure to COVID-19, these areas, these high Trump areas again, are going to be more relaxed in social distancing than the low Trump areas. An interesting pattern though is towards the end, we start seeing this drop, this difference start declining, consistent with kind of the catch up that individuals are now changing their behavior. To kind of get a little bit more out of the kind of the COVID exposure, we're going to think about just compliance with the mandate. So we're going to think of the thought experiment as being the state issues a mandate, irrespective of your exposure to COVID-19, you should kind of follow that mandate. So we should expect to see drops in the variation of your social distancing behavior. We're going to control again still for the exposure to COVID-19 by looking at the number of cases as well, controlling for the number of cases and deaths. We're going to use variation in the state level home mandates adoption. This is kind of just giving you the states and what time period they adopted within the sample. We kind of stop around April 2nd in this version of the paper. And then we're going to do basically interactions with these post mandates and the stay-at-home mandates, and we're going to look at differentials in the high Trump voter share counties in the state relative to the low. And here, for kind of simplicity, I'm just going to give you the overall change of the cumulative reaction. And what you end up seeing is that if we see more changes in the low Trump share counties, we actually see a muted effect in the high Trump share county, and almost a third of the reaction of the low Trump, again, controlling for the number of cases and the characteristics of the county. Finally, we're going to start thinking about changes in risk perception, and we're going to focus on the event of the disclosure of basically a COVID-19 affecting individuals at the CPAC, which is a Conservative Political Action Committee conference, as well as several Republican politicians being affected by COVID-19. So to the extent that kind of if one of your party gets affected, now that kind of changes your perception of the risk, then if we should see a change. If you think it was just differentials in the risk aversion of Republicans to Democrats, then it's not clear that you should see changes in the behavior of these individuals. The nice thing with this setting is that this didn't really affect directly any of the individuals in the counties outside of the DC area. So we're not really using the DC area here in the sample. And we start getting basically reports on March 7th, 8th, and 9th that the CPAC attendees had been contaminated by someone with coronavirus, and that we started seeing prominent Republican politicians self-quarantining. Again, the CPAC was the week before, right? So this is just a disclosure about the information that individuals in the kind of the conservative right were kind of exposed to COVID-19, simply changing the information environment, not the fundamentals in these areas. And what you end up seeing now, that post the announcement, we still see that low Trump share counties are reducing their outings, right? We see almost a 1% decrease, incremental decrease in the post period for the low Trump share counties in both changes in non-essential visits and changes in distance travel. But now we see a doubling, almost a doubling or a tripling of the reaction in the high Trump share counties, right? This is more consistent with kind of a catching up, that now they're perceiving this as more risky than before as people from their party kind of get exposed. We're not saying that low Trump counties aren't changing, because here we clearly see that there is still changing in terms of social distancing during this time period. It's more the differential that basically now it looks like the high Trump areas are more overreacting and kind of catching up, given that they weren't really reacting as much in the earlier onset of the pandemic. To say that this is coming from kind of like the perception from the news source, kind of what we try to do is to tease this out is we're going to classify these areas as MSN versus Fox News based on their search activity the prior year on looking for Fox News versus MSN. And consistent with kind of a change in the perception of the risk from the information, what I'm going to here do is plot again in a bin scatter, controlling for number of cases, population, the search activity for COVID-19 as a result of this ratio of Fox News to MSNBC, right? So the higher the ratio, the more Fox News coverage relative to MSNBC using our measures. And what we end up seeing is in the pre-period, you observe kind of that first variation that I showed you earlier on, that there's a negative relationship with higher Fox areas searching less. But now when we go to the post period, we observe that that kind of relationship actually switched, where rather than having a negative slope, we see a positive slope, where now the higher Fox areas are searching more for COVID-19, again, consistent with kind of the catch up that now at least the information is changing the perception of the individuals based on their political priors. Finally, to kind of finish off my presentation, we're going to explore heterogeneity in social distancing behavior and partisanship. We're going to exploit the facts and see, hey, who are the most at risk? Well, populations that are above 60 years old. So here I'm going to again do bin scatters where I'm going to plot the percentage change in the average in the search volume for COVID-19 against the share of the population. And it seems here kind of from on the left-hand side that, you know, older people are actually seem to be more afraid, or areas where you have higher share of the population being above 60, we observe a higher share about COVID-19. At least these areas tend to perceive to be more interested in COVID-19. Once we kind of look at low versus high Trump areas, we observe slight differentials when there's less of the population being over 60. But once you start getting into, you know, where 14, 16% of the population are above 60, we observe similar patterns. So a muting of this differential. Finally, we could then see in terms of social distancing in the behavior, you know, again, we observe that you see more social distancing behavior as your population share is older, as a result of them being more at risk. But then the interesting stuff here is that when we split it by low Trump voter shares versus high Trump voter share, we really see basically very little variation in the high Trump voter share areas, right? Despite having higher proportions of the population above 60, they're still basically behaving like the lower, the younger areas. And then finally, one thing that we could say, well, maybe the function of social distancing is a function of kind of the economics of your job. A colleague of mine, two colleagues of mine have kind of looked at classifying jobs as with respect to their ability to be done remotely, i.e. telework. So here I'm basically plotting the share of the employment in the county that can be done, remotely. And we observe that, yeah, as the share of the jobs can be, as increases in share of the jobs that can be done remotely are associated with more social distancing. But again, here, even between high and low Trump areas that have the same access to telework employment, we still see a differential in the reactions in terms of social distancing between these areas. Overall, I want to kind of finish off by kind of framing that this is just kind of the preliminary work of kind of thinking about the impact of perceptions of risk in kind of pandemics, and specifically focusing on the political lens. So, we're not making the strong kind of thing that these are kind of causal parameters of interest, but I think it's important to think about implications for public policy with these aggregate numbers and with respect to responses of pandemics from the externalities that individuals' behaviors have, right? Because I think we see a lot of the public policy responses, at least in the Western world, as being very much about compliance, and kind of the underlying view is that individuals, given kind of the objective data, will behave similarly, or at least given kind of a compliance directive from the government, will behave differently. Understanding that there seems to be these variations with at least through these political lens, kind of can provide some insights as to maybe kind of bipartisan mandates being more effective than if you have the two parties kind of juxtaposed into their kind of perception. So we view that understanding this behavior is crucial given, especially in pandemics, given kind of the externalities of individuals' behaviors. And with that, thank you.
Great. Well, I thought that was fantastic. Luigi, should I continue on?
Yes, please.
Great. Well, thank you so much for inviting me to be a part of this. And it is great to be a part of this, in particular with John. I like that paper very much, and you did a great job, I think, of course, setting up why we might care about these issues. So I'm going to present this work, which is joint with Levi, Boxell, Jacob Conway, and Matt Gentzkow from Stanford, and Michael Thaler and David Yang from Harvard. And you'll see there's a very common theme between this paper and the previous paper, but I hope you'll enjoy some of the differences in the way that we thought about analyzing and presenting the data. We came to this just in terms of the background and how we got to this. We came here because it's now well understood that people from different political parties in the United States increasingly have different news sources, have different issue opinions, and even have different beliefs on factual issues. But a question that I think many of us have had in this space is, do the reported belief differences on factual issues continue to obtain on issues that are high stakes at a personal level? And I think there's some conflicting evidence on this. Certainly there's the work by Bullock et al. And prior student Khanna from about 5 years ago now that look at differences in factual beliefs on issues like climate change or economic growth or things like that, and pay people to give factually correct answers. And they show that belief differences tend to go away, or at least partially go away, when you pay people to report the truth. And so some of these differences in opinion that partisans tend to have could be just that we are motivated to take surveys in different ways, and we are expressively responding with our opinions instead of telling people what we actually believe about the facts. On the other hand, there is a growing amount of evidence that partisan differences in beliefs and attitudes can affect higher stakes behavior. There's the Gerber and Huber work from 2009 now that show that people spend more when a president of their party is elected. There's the work by Elisa Long and Keith Chen and Ryan Rolla that show that there seem to be differences in hurricane evacuations in recent years, and attribute that to Republican media downplaying the risks of hurricanes relative to what was reported in other media. Differences in enrollment in Affordable Care Act exchanges, et cetera. And so when the coronavirus pandemic comes around, you see a similar set of hypotheses arise. You see President Trump initially de-emphasizing the risk from coronavirus. And then this, just on a superficial view of the media coverage, this leads Fox News versus other outlets to cover the pandemic in different ways in terms of the severity of the potential problems. And so in light of that, I think we all started to wonder whether you might see different amounts of social distancing by Democrats versus Republicans. And so that's how we came to this, I think very similar to how John came to this. And I want to share with you the research here. So we are going to look, as in John's paper, in mobile GPS data and ask whether Republican and Democratic counties differ in the amount of social distancing that we see. We also carry out our own survey that tries to corroborate some of those data and also try to unpack the reasons why we might see the differences in the GPS data. There's also a model that I won't show you in depth, but will motivate the way that we think about the control strategy and interpret some of the results. I'll tell you about the model briefly in a couple of slides. So let me start by telling you about the data. We get the data from SafeGraph, which is a different source, different aggregator of mobile phone GPS data than John all used. So your GPS device on your phone pings and it's collected by mobile apps. SafeGraph is one of the several companies that collects that. They have about 35 million devices that come into their ecosystem. And what they're in particular going to do is they're going to count visits to points of interest, retail establishments, hospitals, offices, that sort of stuff. And so that's the key metric that we're going to use. However, there are other metrics that SafeGraph puts together, such as the share of mobile phones that we see leaving their home on a given day, and the results there are broadly similar. We're going to combine that with demographic data and presidential election votes. Like John, we're going to use the 2016 Trump vote share as the key measure of partisanship in a county. We also put together a survey which was carried out in early April via a online survey platform called Cloud Research. We got 2,000 participants, and it's nationally representative on key observable characteristics: age, gender, race, and party. So we thought about presenting the data in a slightly different way than John highlights, and so I hope you'll enjoy this part of the differences between the presentations. We decided to look at this primarily from a time series perspective, looking at Republican and Democratic counties. And so normalizing the end of January point of interest visits in a given county to 1.0, this shows over time the amount of social distancing that you observe in Democratic versus Republican counties. And so in Democratic County, we're at about 40% by mid-April of the point of interest visits that we had in late January. In a Republican County, we're in the mid to high 50s. This basic result, this unconditional result, was reported in lots of different newspapers and The Economist, et cetera. And you might start to then wonder what could drive this result. And to try to help understand this, we wrote down a very simple model of optimizing consumers who live in a SIR epidemiological transmission model. And what the model highlights is a very intuitive idea, which is that the amount of social distancing that I'm going to do as an individual depends on several factors. First, the cost of social distancing. So it could be that I have a job that is, is particularly difficult or easy to work from home. We know that Democrats and Republicans have different ages, jobs, education levels, et cetera. And so that could be one thing that drives these results. Another reason why you might see differences across people in social distancing is that the benefits of distancing are smaller. And that could be either that I have lower risk of infection, or that conditional on infection, my utility loss is higher or lower. And so again, here we know that Republicans are more likely to live in rural areas and areas where the coronavirus epidemic started later. And we also know that Republicans and Democrats differ in terms of average age and thus potentially underlying conditions and sort of the harms that are done if you contract the virus. And so it's obviously then going to be key to interpreting these results to try to control carefully for these factors. What happens, how do we interpret any remaining differences? In our model, we look at this through the lens of differentially misperceived risks. So we end up in basically a behavioral economics model of risk misperceptions. And this is going to generate what you might think of as misallocation of risk reduction, misallocation of social distancing across people. And just like in any misallocation paper that you think of, this is going to generate allocative inefficiencies where we could have achieved the same amount of social distancing at lower cost if we eliminated these differences in misperceived risks. So that's how we're going to view this through the lens of the model. The question is going to be, do these Republican and Democratic differences that we just see in the time series persist after you control for the very natural differences in costs and benefits of social distancing? And then to what extent do we think that we could attribute them to differences in risk perceptions versus some other unknown factor? So that's kind of how we thought to proceed with the rest of the paper. I want to highlight, of course, one clear reason why this is going to matter across Republicans and Democrats. So this is just looking at confirmed COVID cases and deaths by a Republican vote share in a county. So the blue lines here are Democratic counties, the red lines are Republican counties. The solid line is cases, and these are confirmed cases, of course. The dashed lines are deaths. And so it's clearly true that Democratic areas, being more urban, are seeing a much more intense prevalence of coronavirus. And so this is a natural reason why you would expect differences in social distancing across parties. You can also see this on maps, and I think John has done a nice job showing you what some of these maps look like. This, just to illustrate, is the percent change in point of interest visits from our GPS data between late January and mid-April. Red are counties where you see the least social distancing, and blue are the counties where you see the most social distancing. You can see, just looking here, correlations between Democratic and Republican areas, but also correlations between rural areas and areas where you saw more cases confirmed by this figures by late April. So these are the sort of factors that we want to think about controlling for. This is the empirical specification we're going to use. We're going to have on the left-hand side the log number of point of interest visits in County I during week T. And we're going to regress that on Trump vote share row, and then control for these series of factors that sort of pop out of the model as additional explanatory factors for differences in the costs and benefits of social distancing. This is going to include known cases at the time, coronavirus attributed deaths, population density, education, poverty, and race. And again, all these are interacted with the time effects, because the whole point is that the association between these factors and point of interest visits is going to change over time. There's one thing that I think is interesting that's worth pointing out. Here we're going to look at the average effect of Republican vote share, or the average association between the Republican vote share and the social distancing at time T, whereas in John's specification, the Republican vote share is interacted with the current number of cases. And so that regression specification is going to look for a tilted, in a sense, more social distancing associated with Democratic areas in the form of an interaction with the number of current cases, whereas we're just going to report to you the main effect. So here's our key figure on the GPS data. This is the coefficient on Republican vote share in the previous regression by week over time. And so you can see there's some bouncing around early on, and in fact, some bouncing around in these specifications very early on, which suggests that you can see these coefficients move slightly in ways that are probably not attributable to differences to factors caused by the coronavirus epidemic. That's what you see in the sort of first three, or the February 2nd and February 9th coefficients. The thing I think that is more compelling about this is that by the time we start to get into March in these data, there's a substantial difference in social distancing associated with Republican versus Democratic counties that outweighs the bouncing around that you see earlier on in the sample. And so how to interpret the magnitudes here, going from the 10th percentile to the 90th percentile of Trump vote share in 2016 in a county is associated with a 22% increase, in point of interest visits during the peak social distancing time in sort of April that we've seen so far. So this is a substantial difference associated with the different parties. We can also, as you might imagine, these coefficients move further up on this figure as we eliminate the controls for state by time fixed effects and the economic condition controls that we discussed on the previous slide. And let me talk briefly about robustness. You don't see similar patterns in 2019. This is robust to various other specifications, such as differences in how we weight by population. It's robust to dropping Washington, California, and New York, which are states that have particular differences and particularly high populations. And it's robust to using other measures of social distancing, as I mentioned earlier. Now, there are a lot of things that could explain these differences still even at the county level. There could be county level differences in stay-at-home orders. There could be county level differences, not in terms of what consumers would like to do, but in terms of what businesses are doing and shutting down. And that could impact, of course, the visits that people have to their establishments. But this could also arise from individual level differences in beliefs. And so to try to isolate or to try to document that this third factor may have at least some role in the differences in social distancing that we saw on the previous slides, we carried out a survey. Let me tell you what's on this survey. There are four key factors, four key questions. One is self-reported social distancing. So this is measured as the % reduction in contact with other people over the past couple of weeks. The second is how people perceive economic trade-offs. We basically ask people, you know, as long as there's no legal restriction on going out, do you think it's, you know, in these times, do you think it's more important to help society by going out, spending money, boosting the economy? Or do you think it's more important to help society by staying home and preventing the spread of the virus? Third, we ask people about the perceived effectiveness for them of social distancing. In other words, the probability that they would catch the coronavirus if they did no social distancing compared to ending all contact with people over the period of a month. And so this is a way of isolating in a survey rigorous way people's risk perceptions for themselves. And fourth, we asked people to predict the future severity of coronavirus in the United States. We told them how many cases there had been as of the beginning of April, and we asked them to predict new cases as of the end of April. And we randomized whether those predictions were incentivized or not. Because this is a factual prediction, of course, we can incentivize people for correct answers. And so this is a design that as some of you may be familiar with the Bullock et al. And Pryor et al. Papers that do something similar, and we were building directly off that design. Here's what we saw in the survey. I'm going to show you, so this is a partisan difference in results, and I'm going to show you several coefficient estimates. The first is without controls, and the second is with controls, where the controls are for demographic characteristics that, again, per the discussion earlier, could be important for generating differences in social distancing due to the personal costs and benefits of social distancing. So when you look at the top coefficient estimates here, the direction of this coefficient is saying that when you don't control, there is some but not a statistically significant difference in the amount of self-reported social distancing, the amount by which people said that they had reduced contact with others over the past couple of weeks. When you add controls, the coefficient actually becomes significant, which is the opposite of the movement that we had expected here. What explains this is actually largely the controls for race. So Democrats, so African Americans are more likely to be Democrats, and African Americans are less likely to report social distancing over the last several weeks. And this is a separate issue that's been also reported in the media. So when you control for that and try to isolate the conditional association between political party and amount of social distancing, you actually get a stronger association between Democrats and social distancing. The second set of coefficients here is the importance to social distance versus help the economy in these times. And here, most people are saying it's important to stay home, but to the extent that there's some variation, Democrats are more likely to say, this is on a 1 to 7 scale, Democrats are more likely to push towards saying it's important to stay home, and Republicans are more likely to push towards saying it's important to go out and help the economy. So this is not about risk perceptions, this is just about differences in preferences. The third, and I think the way that I frame it is not just differences in preferences, but differences in some sense of warm glow, like how is it that you get warm glow from helping other people? That's, I think, the best interpretation that I have of the question we were trying to raise. The third coefficient highlights people's self-reported views about the effectiveness of social distancing as measured by the % reduction in probability of infection if they did no social distancing versus full social distancing. And here you see, again, a strong difference across parties, and that is robust and in fact strengthened by adding these controls. And so I think that this is the key coefficient, or these bottom two coefficients are the key coefficients that will go into our model. Let me tell you about the bottom one. This is the prediction of US cases over the next month. When you add controls, and so this is a case, by the way, where you're just predicting a nationwide number of cases. And so it's not necessarily something where you would think that controlling for observables, that represent the costs and benefits of social distancing would have an impact on perceived nationwide cases. You do see the coefficient move some between between the black and the green in that bottom row. The thing that I think is even more interesting, however, is the movement that you see when you incentivize people. In the prior work by Pryor et al. And Bullock et al., when they incentivize predictions, the partisan gaps in beliefs attenuate. What we see is that when we incentivize people for correct prediction, the partisan gaps in beliefs actually increase. And so these last two rows, the bottom half of this spike plot, are part of the evidence, or I think are key evidence to suggest that it's differences in risk perceptions that explains at least part of the differences in social distancing that we see across political parties in the GPS data and that are self-reported in the survey data as well. So now I want to just talk about why this might matter. So I'll tell you a little bit more about our model, and we're going to put this in the context of our model now. As I said, we have a model of people who are consuming a risky good, which is, do you go to restaurants, do you travel, that sort of stuff. And that risky consumption affects your infection probability. And that's embedded in an SIR model. So there's a number of susceptible people and infected people and recovered people. And I myself have a continuation value that differs depending on whether I'm susceptible, infected, or recovered. If I become infected, that lowers my utility. And so again, as I introduced earlier, this model is going to immediately say that there are differences in differences in costs and benefits of risk reduction across people. But what we add in is the possibility that people might have heterogeneous misperceptions of the risk of infection and the utility loss in the event that I move from susceptible to infected. In other words, the utility loss from infection. And this misperception is going to generate the same sort of behavioral dead weight loss triangle that you see in other behavioral misperception models. And as I suggested earlier, it's going to indeed generate the same sort of dead weight loss that you would see in any model that involves misallocation or failure of the equimarginal principle. So you have two different polluting factories, and if they, the equimarginal principle says that they should abate pollution up to the point at which the marginal costs are equated. If that doesn't happen, perhaps because of bad regulation or something else, then there's a dead weight loss. So it's the exact same idea of a dead weight loss here from misallocation or failure of this equimarginal principle. And so using our survey, we can actually calculate the size of those dead weight loss triangles just using the self-report in the survey. So I don't want to put too much weight on it. But we find that the dead weight loss from heterogeneous misperceptions and the differences in behavior that are then attributable to the heterogeneous misperceptions generates a dead weight loss of about $2.7 billion if it persists over the course of a year. The other key thing to highlight about this model and the interpretation that we impose throughout the paper is that we do not pretend to know whether the social distancing level that is associated with Democrats or the social distancing level that is associated with Republicans is socially optimal. We do know that the Democratic level will result in lower, basically a flattened peak of the spread of coronavirus, which is less likely to overwhelm hospitals and could likely reduce death rates. We know that the quote unquote Republican level of social distancing or a higher level of social distancing is going to have had a lower negative impact on economic growth and business activity during March and April. And so we don't pretend to know the true level or the optimal level of social distancing. We're not saying that one party is wrong and the other party is right. What we can say in the model is holding constant the amount of social distancing we see, that social distancing is inefficiently allocated to the extent that arises from heterogeneous misperceptions of risk. So with that, I'd like to conclude. Again, in this paper, as in John's excellent paper that he presented before, we see the Republicans and Democrats engage in significantly different levels of social distancing. And this is after controlling for factors that that contribute to differences in costs and benefits of risk reduction. The survey indicates that individual actions and beliefs are politically polarized in that sense, and it looks like at least some of this from the survey is generated by heterogeneous risk misperceptions. And I think of this paper and John's paper as part of a literature that suggests that the differences in issue opinions and stated beliefs on surveys can in some cases persist toward to play out in higher stakes behavior. So thanks very much for having me.
Thank you very much, Hunt. Thank you very much, John.